Thank you, Chairman Cox, and good afternoon. Our message today is that we have to hold the line. We have to stay the course. We have to continue to be vigilant. It is important to note that the danger from coronavirus is just as great today as it was at the beginning of March. It's just as great for us here in San Diego as it has been in Detroit and New York and Italy and other places throughout the world that have had struggles. The coronavirus is just as contagious. It is just as deadly. It has the exact same ability to overwhelm our hospital systems as it did at the outset. In San Diego, our saving grace thus far has been our early and swift action, and it has been the widespread community support that we've seen that has helped us flatten the curve, that has helped us remain under our health system capacity, that has bought us time to begin to prepare for the future. We should be proud of where we are today, but we should not allow where we are today to lull us into a false sense of complacency that we are through this. The virus has not changed. The level of transmission that it can generate has not changed. What has changed has been our actions, and our actions are the things that have put us in a strong position. But if our actions change, we will be just as susceptible to widespread community outbreak. We will be just as susceptible to overwhelming our healthcare and hospital systems as all of those places where you have seen the tragic stories on the news and you have seen the horrific pictures play out. It is really important to note that you cannot rebuild an economy if you are in the midst of a pandemic outbreak that is overwhelming your healthcare system capacity. And so what is most important for San Diegans, for all of us to keep in mind, is that we have to stay the course. We are only halfway through the month of April. And if we loosen, if we lose our focus, if we become too antsy, then we could very well trigger a situation here, the likes of which we've seen around the world and the likes of which we have praised our efforts to date as having avoided. And so we continue to ask you to adhere to the guidance to stay strong. We know that it's difficult. We know that it's challenging. But you can't begin to move forward until we are truly in the best possible position to be able to mitigate the spread, to be able to contain the dangers, to be able to continue to work with our healthcare system, to continue to acquire more personal protective equipment, to continue to get the testing we need, and make the plans to move into another phase. And I want to share with you a cautionary tale that I think should serve as a reminder to us all. Singapore has been held up as one of the models around the world of what folks should do. And what you see on the chart that you're looking at right now is Singapore was a model. They took early actions, they took swift actions, they saved lives. But then Singapore lost their focus. They did not do a series of steps specifically to ease or to unwind, but they did have the public lose the same commitment that they had had in the early days. And so if you look at this chart, what you see in the orange line is you see the San Diego new cases by date, and you see overlaid there all of the actions that we took. Our public health officer orders, mass gatherings, social distancing, staying at home, face coverings, and you see the success we've had. But if you compare San Diego County to Singapore on the same trajectory and timeline from the first cases and adjusted for the population of both entities, if we follow the path of Singapore, you can see that dotted blue line is what would happen here in San Diego County. And that represents an entity that got ahead of the curve. It represents an entity that took action. It also represents an entity that lost their focus a little bit. And this is what we are trying to avoid. The concept of exponential growth is such that at the point at which you have significant spread, you have a much less ability to stop it. And so we are asking each and every one of you to continue to hold fast, to continue to stay the course, to remain vigilant, and continue to work through this with us. We want to continue that solid progress we've seen. We want to continue to be in a position of strength. We want to continue to have the ability to prepare and plan and implement the next phases when appropriate in the right way. And that is vitally important, not only to saving lives and protecting public health, but that is vitally important to having the ability to have an economy recover in a smooth line. Before we get into our reports, I want to update on two other things. You've heard us talk about doubling times during our briefings. You see a lot of conversations in the media for other jurisdictions and other places where the notion of doubling times is an indicator of the progress, success, or failure of your region and what direction you're heading. And so we're going to start today and every day moving forward disclosing our doubling times for our positives, for our hospitalizations, ICUs, and deaths. But it is important to note, I want to share with you how we calculate this doubling time so you have an understanding of where we derive the numbers and a little bit of the thought process behind it. Some individuals will simply take the total, cut it in half, back up that many days, and say that is how many days our current doubling rate. The problem with that is given the batching of testing, the batching of results, the inconsistent nature. We always say don't take one particular day as an indication of where we're going, look for a trend. Because of that, you don't want to simply cut the number in half, back out, count the number of days, because you'll see things like if you look at March 28th, our doubling rate of positive cases under that model would have been 11.3 days. The next day, our doubling rate would have been 4.6 days. The doubling rate in San Diego County did not change that much in one day. And so our team here has been working very hard to come up with a formula that takes into account a smoothing over a period of days. The New York Times uses a 7-day smoothing. Scripps Research uses a 5-day smoothing. Some jurisdictions use a 3-day smoothing or average. Some use a 6-day. Here in San Diego County, we've settled on a 5-day rolling average of doubling rate that we think will best account for the erratic nature and inconsistencies of test results, but still give us some clarity and insight into the present state. The second thing is that we're not compounding this on a linear doubling. We are using it under a formula that takes into account exponential growth. Anyone who's worked in finance will understand compound interest in terms of exponential growth, in terms of the rate of the cases. And so we've worked on a formula with experts and researchers at UCSD, Scripps, and San Diego State, who have all given their stamp of approval to the formula we're using. And if there are any math professors with time on your hands and you would like to see the actual formula, we would be more than happy to share with you the technical formula that we are using to get it. But you will see in the charts in a few minutes, and I will point out the doubling rates for each of these entities. But again, it is a formula that accounts for exponential growth over a 5-day average, and we will share those in real time moving forward. Last update relates to the homeless. We have obviously seen the challenges and situations that San Francisco had in one of their shelters. That type of situation where you had an overcrowding in a congregate care setting with the inability to do physical distancing is what led the city, the Regional Task Force on Homeless, the Housing Commission, and the county to move forward with the convention center to get individuals out of a bad situation into a less bad one where we could ensure physical distancing. We also took early actions and steps to put public health nurses in our shelters to do temperature checks and look for symptoms and immediately get individuals who exhibited symptoms or fever out of those settings for further evaluation. We also had public health nurses with our homeless outreach teams for those who are unsheltered. We have public health nurses and teams in the convention center daily doing screenings and temperature checks and monitoring, and a system and protocol in place that anyone who exhibits symptoms can be moved out. But it was concerning today the report out of Boston where they went in and tested asymptomatic individuals in their shelter and determined a number of them have been positive. This is why we have been putting in place for the last few days a process in partnership with the Lucky Duck Foundation and Family Health Centers to test every single individual in the convention center. To go through whether they were all asymptomatic. If they have symptoms, they would already be removed. But we want to test those. We've got a system in place for anyone who tests positive to be immediately isolated and then transported to a public health motel room where they will receive care and help during their recovery phase. But we continue to do everything proactively we possibly can. We generally have not been in a position to be able to test wide groups of asymptomatic individuals. But thanks to the generosity of philanthropists and the partnership of a health system, they're able to do it. We think that it is appropriate, we think it is proactive, and we think it is an additional step we can take to try and protect these populations. They're starting today. The hope and estimate is that they can do 150 tests today. As we get those results, we will share those with you, separate and distinct from the rest of the results that we share. For today's totals, we have one additional homeless individual who's tested positive, which takes us to a total of 15. So with that, we'll jump into our charts for the day. You see today we're reporting 75 new positive cases, which brings us to 2,087. Testing, 1,248 tests were reported to us in the last 24 hours for a total of 29,000. There has been a lot of discussion around testing. This is obviously an issue of concern, both in how we maximize the testing capacity that we have now. Our county team is working in close collaboration with our health system partners to evaluate criteria and see what we may be able to do to maximize the capacity that we have now. And then we also have this separate effort underway, the long-term planning for how we have much wider spread testing as we move into the future that we would like to see. The spread between test and positive is about 96.3% of the tests coming back are negative. You can see the breakdown there. This chart is a daily chart that you're used to seeing. This next one, what you see in parentheses, outlined in parentheses right there beside the positive numbers, is the doubling time in days. And so for our positive cases, we're now at 2,087. Of course, we reported a daily increase of 75 positive tests. 18.4 represents our 5-day average of exponential growth in terms of a doubling rate of 18.4 days, and we will continue to update that every day. For recovered, you see an increase there. Again, this is estimated recovery based on date of positive test and adjusted for the loss of life. Hospitalizations, you see right there an increase of 29 from yesterday. Our rate of doubling in hospitalizations on the formula we outlined earlier is 12.6 days, doubling every 12.6 days. ICUs is an increase of 8. That represents a current doubling rate of 15 every 15.3 days. And loss of life, we have 3 additional deaths, which represents a doubling rate of 7.6. And again, we will add those doubling rates in parentheses beside each of those numbers on this chart every day moving forward. Moving along to hotel rooms, not a significant change in any of the status there, some modest changes. Outreach efforts continue. 211 calls are up, nursing call lines are up, epi calls are up, relatively flat on the other outreach efforts. Personal protective equipment, we saw a jump in every single category, more N95 respirators, surgical face masks, face shields, goggles, gowns, and gloves, all increasing in our distribution to our health system partners. We're now at 2.1 million individual items of personal protective equipment that have been distributed. Our final chart here is ventilators. 22 of 23 hospitals reporting an increase of 572, primarily due to the entities that reported. But again, general consistent participation and help by our hospital partners, which we appreciate. 572 ventilators are available for use today if needed in San Diego County, along with those the county has in ready reserve. That concludes my section of the report, and I will now turn it over to Dr. Wilma Wooten for the Public Health Officer's briefing. Thank you.